First of all, welcome, day 2, Stepping Up Mental Health Summit. Thank you for coming. I wanted to say we do have a full day. We have some great speakers today. The executive director from the Arizona Association of Counties is here to speak, as well as Senator Barto. We also have our first and second intercept models that we are going to discuss. I'm really looking forward to seeing what the panelists have to say, as well as learning from them and how we can implement it into our own communities. One thing I wanted to say, and just say something to the David's board, the awards dinner for the police and judicial officers was amazing last night. I found myself getting very emotional from the stories that of the impact they're making in their communities. We're making a difference in individuals' lives. We're here at David's Hope to advocate for you and support you in anything that you need. One of the main things that I wanted to say that I felt that I wanted to reiterate that Paul Pizzone had said yesterday was, it's about the people. It's about resources, but it's also about moving our communities and our state forward in a collaborative effort. And it was so amazing, and I wanted to thank you all for everything, and I'm so honored to have the opportunity to work with all of you. Thank you. With that being said, welcome to day 2 again, and I'd like to introduce our first speaker. Her name is Jen Marson. She's the executive director of Arizona Association for Counties. She manages the daily operations of the association, as well as the Government Services Foundation. She does this on a state and federal level. Her accomplishments goes on for days and days, just like all of yours. But she is an ASU Sun Devil, yay! But with no further ado, I'd like to invite Jen to come up and speak.
I heard boos already because I went to ASU. I haven't even started talking yet. So thank you for having me. I want to say, I just got my new glasses and they're my first set of progressives and I can't really figure out how it all works, so I apologize for that. I'm very grateful. I was kind of honored actually when David's Hope asked me to come and give some opening remarks today. The Arizona Association of Counties and the Arizona Sheriff's Association are very proud to be endorsers of the Mental Health and Criminal Justice Summit. We've done that for a couple of years now. You know, I think the very bad news, right, is that mental illness in an incarceration environment affects a wide swath of the population. It's not just the person with the illness, it's their friends, it's their family, it's their community, it's the city or county that's taking care of them. But the very good news is that mental health in an incarceration environment affects a wide swath of the population, because then that's just that many more people that we can pull from to try and find a solution. I think that's evidenced by the increased participation that we see at this summit every year. The amount of engagement from the people in the community who care about this issue is not only increased in terms of attendance, but also awareness, and I think that that's a key component. Creating partnerships across a wide variety of these disciplines, whether it's different levels of governments or community organizations or faith-based programs, is going to be the key, because there's no one group or entity that's going to have the magic solution. Although I think Miami-Dade came kind of close, right? We all know that story of the success that they had in Florida. And while the idea came from one very passionate individual, he pulled from this department and that department. And, you know, this other county and rallied these people who had a passion for this kind of work, and that's how they got to be successful in Miami-Dade. So that's the kind of passion building and creating that we need to continue to do in Arizona as well. I've been working with counties for 15 years now here in Arizona, and I'm very pleased and proud of the work that they're doing in this environment, not only in Arizona, but in counties across the country. I wasn't able to be here yesterday, so I hope I'm not going to be duplicative, but with La Paz County passing a resolution earlier this year, all 15 of Arizona's counties are now endorsers of the National Stepping Up Initiative, which I think is fantastic news. And what that means is that Arizona is actually the first state in the nation to have all of its counties participating in Stepping Up. So I think that's right. I mean, in fairness, we only have 15 counties. They're huge in terms of landmass, but like there are some states that have hundreds of counties. So the bar is a little bit higher for them, but we'll take the win anyways, right? Exactly. So, our association, there's another association in Arizona, the County Supervisors Association of Arizona, was very diligent in getting all of those counties to sign up. But a lot of the work, the lion's share, actually came from David's Hope. Employees and board members of David's Hope went around the state and educated county leaders about the breadth and depth of this issue, the personal, the emotional, and the financial cost associated with having the jail environment be a hospital for those who have mental illness. So if we could do another short round of applause for David's Hope and all of the work that they're doing. And throughout that resolution process, when counties decided to sign up, what we found is a lot of our counties were already doing some fantastic things in this area of mental illness and the jail environment. We just didn't label it Stepping Up, right? They were doing things before the Stepping Up initiative occurred. And I just want to point out some of those examples. And again, I know that you heard from Sheriff Masher yesterday and Sheriff Penzone yesterday, so I hope I'm not duplicating too much. One of the things that jails have long done is have crisis intervention teams. And depending on what county you're in, they call that something else, potentially. But that's a team of people who interact with the person the moment that they step into the jail environment to find the right path of treatment or safety that that person needs. So those crisis intervention teams have been around for a really long time. Another thing that's happening in our jails in Maricopa is a stunning example of this, is they're really moving to an electronic format for data. We're getting away from the paper. Not all counties are able to do that right now, but some of them are. And what that does, not only is it more efficient on the front end to take in the data, of course, but when you have it electronically, it gives you the opportunity to be able to mine it, essentially, and research it and make fact-based decisions. Because unfortunately, when we're dealing with mental illness, a lot of the times we're dealing on a guess, or we're dealing on a preconceived notion. When we have the data, that allows us to make fact-based decisions about how to handle people who have mental illness when they come into our jail environment. So that's a key component. And then, of course, mental health courts. Counties, not all of them, but a lot of our cities as well, have mental health courts. And these courts, were around before the official Step Up initiative came into being. And they're just a way to try and process those folks in a way that doesn't necessarily involve incarceration, but provides an out-of-incarceration treatment plan to hopefully make them better and make our communities better. So those are just some of the examples that the jails were already doing, and now what's happening is there's more of a laser focus associated with mental illness in the incarceration environment because of the Step Up initiative. So I think that's fantastic. I mentioned Miami-Dade already because they're a stunning example of how we can make something like this work. And I think a huge component of the Miami-Dade success is training. And training that is cross-jurisdictional or cross-departmental training is huge. One of the things that we do a little bit of in Arizona that I think we could do more of is making sure that mental health professionals, those who actually are the doctors or the therapists or the treatment providers, are involved in the planning process when we design the training that occurs at ASPOST. ASPOST is the Arizona Peace Officers Standards and Training Board, and this is where all of your law enforcement officer training is certified. So whether you're a brand new officer right out of the academy, or whether you're a 10-year veteran but you're going for some continuing education, ASPOST is the entity that certifies your education. So if we can make sure, I understand that there are training cohorts that deal with mental illness, But I want to make sure that the providers are helping craft the training. Not just that the training is occurring, because that's like step 5 in the process, right? Step 1 is getting the right people at the table to put the training together. So I think that's one of the things we could do a better job of educating those people who create those training programs. Okay, here's my out-of-the-box idea. I'm going to go off on a little tangent for just a second. How many in here know what a CASA is as it relates to the courts? Not a house in Spanish, but a CASA is an acronym, okay? It stands for Court Appointed Special Advocate. And in that world, what it is, it's a volunteer person who's been extensively trained, who's assigned to a child who's been removed from the home. And the CASA is the person who specifically advocates only for that child, okay? The other team, if you will, of people around that child, whether it's attorneys for the parents, the DCS caseworker, what have you, those people don't go away. The CASA does not replace. The CASA is an addition to. I was going through CASA training a couple of months ago, and this is where this idea came from. What if we had something like a CASA, but for those who are suffering from mental illness and are encountering our jail environment? Someone who is just there to advocate for that person, it's not an attorney, but someone who can look at the whole picture. Because sometimes what happens is the people who are interacting with that person with mental illness, they almost have a tunnel vision because they're focused on providing their service or their words of encouragement. But sometimes you need someone who can kind of have that 30,000-foot level and represent that person when they do have to go to court or when they do have to go to a meeting or something like that. I don't know if this is feasible. I think there are smarter people in this room than me that now that that suggestion's been thrown out there, maybe we can have some conversations about that and see if we can get that volunteer advocacy program going in a CASA-like model, but for those who are suffering from mental illness. So it's just something to think about. I think that the majority of us are related to, or are friends with, or are co-workers with someone who suffers from mental illness. And I think that we know that in many cases, those folks are one bad episode or day away from being misunderstood or misdiagnosed and finding themselves in a jail environment. I have a brother who's schizophrenic, and many years ago he had a very bad day, and he made some very bad choices, and he found himself in jail. And that was, I think, the most difficult thing that my family has ever been through. And my family, based on what we did or what my parents did, they had some resources. They knew some people to try and get him some help when he was in that environment. But I can't even imagine the struggle that it was for us. I can't even imagine what it would be like for someone who didn't have that resource, didn't know even the first step to take, much less the 5th step down the road. So the kind of work that you all are doing is something that I find particularly valuable and I personally have a passion for. So I want to thank you for doing that work. So many years later, my brother's not in jail, but he still has schizophrenia. And he's still one bad day away from maybe landing in that jail environment again. So I like the term constant vigilance. Are there any Harry Potter fans in the room? One? Harry Potter is awesome. Get on board, people. Okay. So there's a character in Harry Potter whose motto is constant vigilance. That means always being vigilant, right? I think that applies to my family, making sure that my brother's going to be safe and supported and cared for, but it also applies to this kind of community. And what I mean by that is Miami-Dade's story, fantastic. Do you think that Miami-Dade just wiped their hands and said, we have a great model, now we're done? No. They're constantly reviewing the model that they have to make sure that it's going to work, because just because it works in 2017 doesn't mean it works in 2020. Sometimes as governments, boy, we like to be in our rut. And we don't want to change something that's working really well. But just because it's working well now, we have to plan for the future. And so that constant vigilance is key to make sure that we're always on the right path. We can't just be on the right path right now. We have to be on the right path tomorrow as well. Mental illness, and the key for that is because mental illness, as we know, it doesn't discriminate. It doesn't care how old you are or what you do for a living or how much money you make, right? And so it's going to take people of all ages and races and professions and socioeconomic backgrounds to solve this problem. And that's why all of us are here today. So with that, welcome to day 2. Thank you very much for being here. I know that you will find value in the programming today, and that's all I got.
Good morning, everyone, and thank you for being back with us again for a second day. Our time schedule will be a little off, as we said, because of the little bit of a late start, but we appreciate you all getting through the traffic and getting here for us today. I want to give Nastasia Walsh a thank you for coming back again with us. I feel a little guilty, like I should have incorporated her into another event today, but she's graciously opening herself up to any of you that want to talk with her. I'm sure she's willing to miss parts of panels or whatever's going on if you'd like to talk to her one-on-one while she's here. And she's also going to be totally accessible to you when she returns back to Washington. So if any of you want to contact her today or in the future as you do your county planning, Nastasia is giving you an open invitation to do that. And no one knows more, I don't think, about stepping up than Nastasia. Don't you agree? No one could. We've been seeking for that presentation for a couple of years, and she was able to give us the whole perspective yesterday. I also want to thank Sherrie Fraley, who's going to be our new board president, coming up here very soon for a great introduction today. Thank you, Sherrie. Thank you for having your team out here to help us with registration. And thanks again to the sponsors. Simpatico, a huge sponsor for us this year, and Mercy Maricopa, Connections, AZ, and we have, okay, help me here. Am I leaving it? Well, we have a lot. We have Spectrum. We have a lot of sponsors here, so I won't go down the whole list, but you mean a lot to us. It's critical that you're here with us, and we won't be able to continue if you don't stay with us. So we just want you to know how much we rely on that support and how much it means to us. And we had several new sponsors this year that we haven't had in the past, and that's very encouraging. So thank you for that. The other thing that I'm going to be introducing Senator Barto, but I wanted to mention one other thing. For those of you that were here last night at the Ward Center, we honored 4 women who founded the Arizona Mental Health Criminal Justice Coalition, who had handed that coalition off to us at the end of 2012. That was Rebecca Trexler from Maricopa County Adult Probation, Norma Brazda from Maricopa County Adult Probation, Shelley Curran, who was with the REBA at the time. It was a different one, but in the same position, and Dr. Don Nagel, who a lot of you know, who is leading the charge from Maricopa County Correctional Health Services to make a difference for folks incarcerated there with mental disorders. And when they got up here, not a one of them would talk about themselves and the great work that they did, creating the coalition. And they were saying, well, we want to thank Mary Lou for carrying this on and all that. And I couldn't help but to think, Steve Harvey, our board member who was the one working so hard to get all of our counties signed on, taught me one of the great lessons he taught me is don't forget one of the most famous words of Ronald Reagan. What he said, there's no limit to what you'll be able to accomplish as long as you're willing to give someone else the credit for it. So I didn't think to say that last night, but I'm saying it now. And I just mean that. So, and remember that as you guys do the work, because you'll be able to get a lot more accomplished if you're willing to give someone else the credit, right? Okay. So I'm going to introduce Senator Nancy Barto. And I'm going to go over a little bit of the technical part of her bio. First, Senator Nancy Barto represents Legislative District 15 in North Phoenix, Cave Creek, Scottsdale, and Glendale, and has served in the legislature since 2006. Nancy chairs the Senate Health and Human Services Committee, focusing on health care, welfare, and family-related issues, and serves as vice chair of the Judiciary Committee. Nancy has sponsored major health care reforms, increasing affordable health insurance options, price transparency, protecting patients and health care providers, fundamental freedoms, and those of the unborn and other vulnerable populations. Recognized as a consistent leader for Arizona families, Nancy has championed important medical, tort, property tax, and homeowner reforms, and been a voice for reform and accountability in Arizona's foster care and behavioral health systems. She's also served as co-chair of the Child Safety Oversight Committee since 2013. And I want to tell you that the way we met Senator Barto was trying to find out what senators were working on this issue. And I remember when Senator Barto, we were talking about this morning, was a member of the Maricopa County SMI Commission that existed for a long while, and there's no commission like that exactly in place now. But I remember the tremendous work that you all were working on back then. So she's long had a history of working to improve care for people with mental illness. And I'm always, so we started, going down and giving her an earful, of course, and she always had her door open. And I was always so happy because after we had met with her, we had heard reports about her, calling in folks, and I always say she's on a fact-finding mission like a detective, and she's just going around, like Inspector Gadget, and turning rocks over and trying to find out, what's underneath this stuff. Why does it stink so bad, some of it? And she has been someone who is not afraid to ask the hard questions. And the report that we had heard was that when, the senators and representatives oftentimes will call for important folks to come in and give them feedback on issues that they have questions about or things they've heard complaints about. And Senator Barto would meet with many officials, and we often heard that she was asking the question, when she'd received the word that everything was going along smoothly, that she would reply with, well, why are so many people in jail? Why are so many people with mental illness landing in jail? Can you answer that question? So when we started hearing that you, Senator Barto, were asking that question, we felt like we had really hit a home run. I know that we weren't the ones that brought it to your attention. I knew you knew about it for a long time, but she's a person that knows how to ask the right questions. And the way our climate has been is so politically divisive. And many of us in this room come from different political bents. But I'm telling you, she's a person that's opened up the door to get to the real issues, and she doesn't care who or what is standing in the way. So we just thank you for that. And I will let you take the stage and put Jag on here.
That was incredible. She's trying to make me cry, so I can't read my notes. Mary Lou, I really appreciate that. I feel like as a legislator, we really don't do anything good unless we hear from others. I mean, we don't have any good ideas ourselves. We get them all from you when you tell us about the needs. And so that's how I see this history and our work together, our collaborative work together over the years, because I've either heard from Mary Lou or families or, some other person, a family member's friend, or that the need is there, and that's when I think legislators really can do some good, is when they do listen to the community. And I'm going to kind of start the same way. Marson, what is your first name? I'm sorry, Jen started. With the good news, bad news thing. I think we have so much good news on how we're progressing on mental illness in Arizona, and it's due to a lot of you in the room. And I just I'm just grateful, to hear this being promoted, that Arizona's getting some kudos and well-deserved recognition for all of you staying at the table, being so committed. That's the biggest thing, I think, is being committed to seeing through solving the issues. With CIT growing and law enforcement doing their humongous part in treating the mentally ill the way that they need to be treated when they are encountered. The public awareness piece coming into full view. I think this is something we can really be excited about, because more and more people are feeling like they have buy-in, like they need to get involved in some way. This is a great thing. It's a great thing to build on. What I'm seeing on that score is, the faith community rising up, and pastors and leaders wanting to get trained. They see these people in their congregations, and they don't know what to do. And so, I just see a lot of really healthy things being spawned from what you all have started and what you continue to do with David's Hope, the East Valley Coalition on Behavioral Health, and what's happening with trauma-informed communities, and at ASU. These are all, I think, kind of, just shining lights in Arizona that we can really be grateful that we're seeing right now at this point in time. Of course, there's bad news, and that's why we're all still here. We still see so much devastation, in spite of the fact that Arizona still spends the most money than any other state. And still, as Mary Lou said, why do we have so many people that are homeless? Why do we have so many people in our ERs repetitively and in jail one episode away? The good news, again, is that all parties now, and this didn't used to be, are starting to recognize that not everything's okay. It was kind of like a lot of this, where people were saying, not everything's okay, and others were saying, but. Now everybody's coming to the table and acknowledging everything's not okay. And that, again, is progress. Back to the spending. A lot of times that's where we really have so much of our tension, is we need more money, but we spend $1.2 billion a year in Arizona. $600 million of that is state general fund. And yet there's so much more spending by you entities, by the counties, by the cities, and by other entities that we can't even count. We wonder how much money we're really wasting by not addressing the nubs of the issues. A third of the 35 to 40,000 inmates in our state prisons have serious psychiatric problems. Some of the other serious issues that are obvious now and that people are starting to acknowledge is the psychiatric bed shortage. You've all seen the charts when deinstitutionalization took place in the 60s, when about 450,000 people were institutionalized and about 100,000 were incarcerated. Now it's the opposite. So you've got that clear trend line where people with mental illness were told, we will take care of you in the community. And yet now, we've just seen them be trans-institutionalized, haven't we? So in Arizona, we're seeing that acutely. In nationwide, there's about 20 beds per 100,000 people. In Arizona in 2014, only 6 per 100,000. So there's about 100,000 bed shortage nationwide. And that has to be acknowledged and dealt with. And it needs to be dealt with soon. Because when we don't deal with that primary issue, then we see all of these other things trickle down. It's like a waterfall. And we're trying to deal with all of the issues that are around that waterfall, all those issues that spill everywhere else. The families that are trying to navigate the system that somehow is making it their fault a lot of times, or that's how they feel. Because they are not able to deal with a system that's telling them that their family member is ready to go home with you. Then they know better. They know that they need a place that's going to allow them more time to recover. It might take them a few years. It might take them a few more months. It might take them forever. They might need long-term supports. We see the criminal justice system overburdened, like we talked about. Not only monetarily, but it's not only bad for police officers to have to be in harm's way, for a person that's a danger to the public or to themselves, but it's abusive to the mentally ill person. We don't have to look very far to see connections between those people that are untreated and that pose a threat to the larger community. We've seen it in horrendous outbursts and shootings throughout our nation. And I know that by themselves, when people are treated, they're not usually a danger. In fact, they are usually the victims of crime. But when they are untreated, sometimes we have to acknowledge that this is a problem. This is a safety issue. And connecting those dots has to be a part of solving it. So that's why we're here. We're here because we recognize there's so much that is left to be done. And I just am grateful for the opportunity to talk from a state level with all of your help. Many of you were involved in some of the things that we've been able to do over the last couple of years. Some of the progress we've made legislatively and what what I kind of see, where I kind of see us going, where we're at now, and how you can perhaps be involved. We started in 2016 with a couple of, I think, really key bills. One of them was simply a resolution, a Bill of Rights for caregivers that allowed the family's voice to be heard at the state legislature. And it had been a while, I think, since they had really had that opportunity to come and have this piece of paper that outlined what we're really dealing with when we're trying to navigate the mental health system in Arizona. And it outlined the kind of expectations that I think that they deserve, some respect, to be listened to. And so that was, I think, a good place to start. It opened a much-needed dialogue, not only between the legislature and family members who came to testify or sent their their stories by email, but I think the wider treatment provider system, they needed to hear that, and they were involved very much in supporting it, because a lot of you recognize that too. You recognize there are some people that really could use better training in what you're doing. There's a very keen shortage of trained professionals in what you do. You know, your hearts are there and you're doing your darndest to manage the mandates that are upon you to do what you do well and within the law, and to treat everybody with respect. But you see it. The system's overwhelmed, and sometimes the families aren't treated and welcomed in the way that they should be. The second bill that we passed was Senate Bill 1442, and it keyed in on an element that had been really riding way below the radar, and that was our HIPAA laws. A lot of people, providers, have used the excuse not to include family members and caregivers of the seriously mentally ill, and not to include them in their treatment plans the way that they ought to be, because they read Arizona's law, and it was written in such a way that, gosh, you wouldn't want to talk to anybody that wasn't the actual individual with seriously mentally ill problem. So it was incredibly necessary for it to be rewritten so that the intent of the federal law was communicated in Arizona statute, and that's what we did. The intent of the federal HIPAA law is for the patient's best interest to be given priority, and for physicians to have the flexibility to make those determinations on when it's appropriate to communicate with family members, relatives, and others that are close to them. So it was an important bill. I mean, can you imagine in other scenarios where a family member takes their, let's say, their elderly parent to the ER after a stroke, and they're incapacitated, and after several days they're still not thinking clearly, and yet the physician and everybody in the hospital will not communicate with you about their care, and you are really responsible for their care? And yet they're told, when they have a little bit of understanding, oh, you don't need to be here, you don't need to receive treatment. You'd think that was inhumane, if not crazy. And that's what happens so much with adult children with mental illness. parents, caregivers are completely left out of the conversation, when they ought to be welcomed with open arms. Now, a lot of people do welcome them, but it happens all too often when they're not. Many won't even receive information from family members who know them best, who know what their history has been like with them. And yet they're the ones, again, who upon discharge are going to be caring for them at a level that none of them are going to have to bear that type of burden. So 1442 was I think, a good place to start with addressing that communication gap. This year, we did a couple other bills, 1440, which involves oversight of the system. And Access has just designed an oversight committee, a clinical oversight committee to review their services for all of their population. And so we thought, you know what, this is a great opportunity for family members and other stakeholders to be involved in the behavioral health side of that, looking at what's not working in behavioral health and being that voice, that outside independent voice on Access as Clinical Oversight Committee. And Access was very willing to put that in statute, so we're hoping for some appointments there and see some progress. This is a very small first step in part of what else is missing in the statewide conversation, in the state level conversation. That is better oversight of the services that are delivered. You mentioned the lack of beds and appropriate facilities, housing. This is the kind of issue that this is related to. What services are being provided to which individuals with serious mental illness? Because not everything works for everybody. And so this is a first step, again, in accountability, making sure that services that are delivered are evidence-based, that they have a history, that they have some accountability. Are people not ending up cycling through ERs with under a certain type of protocol? Are they avoiding homelessness? Are they ending up incarcerated or not using certain protocols? These things deserve measurement, shouldn't they? So this is a first step again. The second point of accountability that we've been shoring up is with the human rights committees. And who knows what human rights committees are? Yay. A lot of you are on them, and God bless you. Another point of education for us as legislators that we didn't even know they existed until some of them started coming to the legislature and saying, hey, these things aren't working very well right now. And so human rights committees are legislatively constructed committees that are independent. And they are organized, they decide who's going to be on the committee, and they decide if somebody is no longer going to be on the committee. They are independent. But they have to work with agencies who provide them with information about the services delivered to special assistance populations like those with serious mental illness. So they receive reports about incidents and accidents that happen in relation to the services that these vulnerable adults receive. There are three. There's a Northern Arizona, a Southern Arizona, and a Maricopa County Human Rights Committee. There's one at the state hospital, and there are several around the state that observe DD services. So the opportunities to serve on those, if you have an interest, is key, because they're the eyes and ears for the legislature and what's going on the ground. It shouldn't be an adversarial type of committee, but a collaborative working together with the agencies they look at these reports and they can ask for further information. How was this resolved? Was it resolved? And then in their annual reports to the legislature, they can make general recommendations for system change to us. So we hear the voice of the HRCs while they are interacting with some of the actual agencies and providers dealing one-on-one. They're an incredible asset to the state of Arizona, and I'm not sure how many other states have those in place. But as I said, Senate Bill 1004 from this year, and we passed another HRC bill a couple of years ago, helped make them functional again, because there were issues with communicating with the agencies, making sure that that the HRCs were getting information and all of that. So they're getting to be functional again, and that's good news for all of those that are receiving services. Another important bill we passed this session is HB 2043, dealing with the state hospital property at 24th and Van Buren. As you probably know, it's an underutilized asset of the state. The state hospital, of course, is not going away and will continue to serve its purpose, but 2043 allows the state to enter into some public-private partnerships to promote a psychiatric center of excellence and utilize that property in a better way for the benefit of the mentally ill. The bill authorized them to move forward, the Department of Health, to move forward in getting and receiving RFPs for different ideas to serve the state. 2043 also made sure that there was a little bit of accountability, and that's where you all come in, because Centers for Psychiatric Excellence in other states have sometimes led to psychiatric beds decreasing or meeting needs that have nothing to do with the mentally ill and the services that they so importantly deserve. We want to keep that from happening, because the charge of the state trust land is dedicated to serving those with mental illness in Arizona. So 2043 makes sure that this is a public process, that JCCR, the Joint Capital Commission, has a review process that's public before RFPs are awarded, that the public is aware of what they will do, who they will serve, how much money is involved, all of those incredibly important questions. Moving on, I think one of the very important issues we did this past year was Senate Bill 1278, is reauthorizing the Felony Pretrial Intervention Program. You all know about that, I'm sure. We put almost $3 million into that, and it's a diversion program for those with substance use and co-occurring diseases or conditions. So to make sure that we are diverting people from jail and prison that need to be diverted into treatment. The program has a success rate of reducing recidivism by about 20%, saving the state about $20 million over 2 years. That's their history. So growing that program, making sure that it is not going away but increasing its visibility and usage in Arizona is key. But I think it's only key if we get to the initial issues of treatment. Because if they're getting diverted into treatment, we need to stop the cycle so that they don't end up there, do we not? So again, we don't want to just pour bad money, good money after bad, but this is certainly a way of making sure that as far as it is possible, we can get them diverted into treatment and not treat them in jail, which is a completely inappropriate place for treating those with mental health conditions. So ongoing legislative efforts, we had two pretty big issues that we had a lot of you in the room about this past year. One dealt with hospital boarding, because hospitals, again, are bearing the brunt of too many presented in their emergency rooms that really shouldn't be, and having a hard time getting them released and discharged to the evaluating agency that's supposed to be ready and willing to accept them when the hospital says they're ready to be discharged. Well, there was a huge bottleneck, and in some cases there is, but they're working on it. So the hospitals have been the targets of some lawsuits because they're holding people longer than the law allows. So everybody was coming to the table asking, how can we resolve this issue? And it put a laser beam focus on it. And it was great to see a lot of collaborative ideas come out of that. There have been some ongoing work groups that some of you, I'm sure, are part of, to make sure that we're heading towards solutions here, that more evaluation opportunities are there when they are needed, so that hospitals aren't put in an illegal situation. The other issue has to do with police pickups. Another funding shift away from the general fund is obviously to law enforcement. And the questions being asked by many in law enforcement, how appropriate is it for a police officer to always have to transport a discharge just because the statute says so? Can we make it a little bit more based on appropriateness from a hospital to UPC or elsewhere? So that question was didn't end up being resolved in legislation, but I think there's some good conversations that still need to be had to help resolve that. A lot of that has to do with money, who's paying for what, and trying to really get to the definitions of when is a police officer the most appropriate transportation vehicle. So the third ongoing effort at the state level is the INDY committee, the Incompetent Non-Restorable Dangerous Defendants Committee, upon which I'm a co-chair. And the issue we're trying to solve there, again, is what's happening with those that are deemed incompetent to stand trial and non-restorable when the court says it's time for them to be discharged and there's no place to go. Are they a danger to the public? Are they not a danger to the public? How many are we talking about? Who are these people? Some, we think, are seriously mentally ill, and some are other types of people that are also deemed incompetent to stand trial and non-restorable. It could be DD, they could be very elderly, Alzheimer's. So we are studying the issue before we try and organize a solution that could cost a whole lot of money if we guess wrong. So this is important because it's a public safety issue, obviously, and we've had quite a lot of coordination and cooperation from the counties. We've been collecting a lot of information in order to move forward with our analysis. We're working with the ASU on this, Michael Schaefer, and they've been really helpful with doing that. We thought we'd get it done in 1 year, but we had to continue the committee because a lot of the counties weren't collecting that information in a format that we could really use. So this is an ongoing important issue. The bottom line here is that there's still a lot a lot for us to do. We've made a lot of progress, and I think that needs to be encouraged and acknowledged, but frankly, passing laws doesn't necessarily translate into changing the system, so it's going to take vigilance. Even the HIPAA law we changed. I know that hospitals are retraining their physicians on how the new HIPAA law is worded now, but is that really changing their risk management strategy in dealing with patients? No, it's not. So we have a lot of educating to do in order to make these laws really work so that families are included. There's a huge, as much as public awareness is being, the public is coming alive to the issue, a lot of people don't understand why someone they might know with a family member with serious mental illness is not able to just have it treated by the system. Why is it still a problem? They need to understand the seriousness of the family's burden. And I think this is the empathetic part of the family awareness promotion that we have to be espousing, that we have to be promoting, is not only fixing it, but making people aware that those with serious mental illness really have a daily struggle, and that their help is needed, that they are in the community. They're the only ones, really, people around them that know them, that are in relationship with them in community, in their faith community, their work, that can really help. I love the CASA idea. I think we have yet to really look outside the box. What I'm seeing in the church is, I think, phenomenal. Similar to what we're seeing with the church stepping up on foster care. Use of the care portal. Anybody aware of that? The care portal is an online tool that attracts different community members, churches. They can sign up and they can meet physical needs of families involved in foster care. And they can connect with them, which is the best part. They can deliver that crib. They can, in person, because they're people in their area, and they can start a relationship. The same needs to happen with those that have serious mental illness, because the families are getting burned out, and they're worried. So I think we have a great opportunity under a governor that is open to including the community more than ever, more than I've ever seen other governors do. And I think we have an opportunity to encourage the kind of statutory changes that may need to happen to allow communities to interface better with government. So it's encouraging, but it's still an issue. We need to do better on the criminal justice front, obviously, adding accountability measures. I think with the felony pretrial, the FPIP thing is a fantastic vehicle to divert people with felonies away from prison, but we could make it a misdemeanor program, because those are the ones that end up repeating more and end up incarcerated longer if we don't divert them. So we need to be looking at court operations that are working in different jurisdictions and mirror those, replicate those. And I think we need to do a little bit more, a better job of accounting for what's happening on the inside. One idea has been banding about is replicating the HRC model for DOC. Obviously arranged a little differently, but people need to be more aware of what's happening to these people that are so vulnerable on the inside. And legislators are accountable for what's happening in DOC. And we should be, I think, more proactive in following who's getting health care for these especially vulnerable adults. We need to continue to monitor the transition programs and their efficacy. And then last, I think we need to make sure that we're not, that we take advantage of our laws. You know, Arizona has really good laws on AOT and on involuntary treatment. I think we can make better use of those so that those that need involuntary treatment have a better, easier way of getting it, and that it's followed through. There's a lot that needs to be done that we all, I think, can help forward the kind of information that we have learned here at Stepping Up, that the issues that we are involved with. And you know, my door is always open. I hope that you will continue to communicate with your state legislator and promote the kind of accountability you want to see in your neck of the woods, and help with the brainstorming. I think we're at a critical point in our nation where, you know, we're going to be judged on how we deal with the most vulnerable, and continuing to push it under the rug in certain circumstances just because it's always been the way we do things. I don't think that flies. I don't think that flies. At the end of the day, I know I'm going to continue to work on it, and my door's always open to anybody that has good ideas and is willing to help me push them through. At a state legislature where everybody's sort of doing their own thing and has different focuses, but a lot of people care. A lot of legislators care about this issue because their constituents bring it to them as well. And they want to see resolution. They want to see a system that's functioning well and that isn't shifting costs unnecessarily, wasting money, and most importantly, ruining lives. I don't know if we wanted to take any questions.
Yeah, let's do, and we'll get the microphone. We have a couple ones that are not Thank you, Senator Barto. Amazing remarks.
Okay, please raise your hand and keep it raised at least periodically so we can get around the room quickly.
Well, thank you for your remarks, Senator Barto. I would have to say in the vernacular, at least to the behavioral health community, you get it. And I'm very happy about that. The question I have has to do with parity. We know that the mental health parity laws were signed variously and a long time ago, but we, as NAMI Southern Arizona, have had great difficulty getting any response from the state insurance department about parity violations that we're observing, and I wonder if you have any suggestions about how we might crack through that barrier.
This is a big question. I think part of the reticence to mandates from legislatures stems from the increased costs. And that's something that's not, that a lot of us feel is not going to long-term lower costs for insurance. Having said that, I think there's a place for this discussion, because when you conflate every behavioral health condition with a brain disease, I think we're missing the boat. So I think in what I'm hearing, the feedback from a lot of coverage that's in the private insurers now with substance use and treatment is it's not always really that beneficial. It's not enough, and it's being abused to a great degree. That's the feedback I'm getting from a lot of treatment organizations. So I think the discussion is definitely worthy of promoting, and I'd like to see more of the scientific evidence for perhaps looking at it as a health condition. It's not a behavior. This is where I think there's a real opportunity to look at outcomes and create that connection. Do outcomes for certain treatments work for these certain conditions? Or are we under-treating everybody, or treating everybody the same? There's a lot that needs to be explored on this. I think there needs to be a lot of research and analysis of the research to get to kind of the nub of those questions, so that we can, if we do move forward on a cooperative type of mandate and parity for mental illness, it's done with the kind of, that we can do it successfully.
Good morning. Thank you for your remarks. My name is Julie Duval, and I'm here as one of the Pima County Public Defenders representatives here. And I have a question. We were fortunate enough to go to the judge from Miami-Dade's presentation in Pima County. And one of the things that is different in Arizona that we understand from Miami-Dade is that judges can create felony level diversion programs in Miami-Dade after that judge worked on that. And I wondered if there was any movement in Arizona at the statutory level towards making that reality. Thank you.
If I understand your question, you're wondering if we do a felony diversion program. We do have a small one, and I think it needs to grow. They've had one going in Pima County for many years that has been very successful on low-level crimes. And the FPIP 1278 that we passed this session puts about $3 million into that program here in the state. So I think we're on the right track. I think it's a huge piece of the puzzle in terms of making sure that people are diverted appropriately when they're in for low-level crimes.
You Senate Bill 1278, and you say low-level crimes, but for a person that's addicted to substance abuse, a third time into the system, you go into the mandatory laws, mandatory sentences. How does 1278 not handcuff the judge to let that person with the third conviction say possession of marijuana, he's mandatory to be sent to DOC by the mandatory settings. How can we fix that with 1278?
Well, I'm not sure we can with that program in particular. I think on the transition part, when they do get out, I think there will still be a good hammer for them to get into treatment at that level. So that's the upside of the incarceration. It does keep the hammer where it needs to be in a lot of people's circumstances when they really have a hard time getting clean. Hopefully they will have tried through an FPIP type of process ahead of that. It's an interesting discussion because, you know, when you dig down a little further into some of the possession crimes and convictions, a person can be a user one day and a seller the next. It's a difficult and complicated issue. Looks like you guys have it all figured out. I appreciate them. Thank you so much for your great listening ears.